Uh, so just a little bit of background on the sport and exercise medicine program. I've got a brief agenda to work through with you this evening, um, and I will leave lots of time for any questions. We'll start with just a brief introduction of who I am, of the origins of the program and how it's structured, and currently what the structure of the program this year, even though there may be some small changes moving forward. Sort of my background is a training as a physio. I did this student trainer thing while I was in phys ed at Western. Um, Worked as a kinesiologist for a couple of years, went back, did a physiotherapy degree at McMaster, moved back to London, did a physiotherapy fellowship and a research master's on lower extremity injuries and returned to sport. And for 18 years, I worked as a physiotherapist and clinical and research coordinator at the Fowler Kennedy Clinic. And in 2018, I took a leave to help rewrite some sport medicine and orthopedic curriculum for the physiotherapy school, and then returned to the Fowler Kennedy Clinic as the director and the field lead for the sport and exercise medicine program as it exists now. Um, the origins of the program were to look um, at opportunities for clinicians that wanted to do continuing education, but perhaps not a PhD, more of a clinical focus. And it's through the lens of physicians and physios training together. This model has worked in other countries around the world very well. The course is designed to train all aspects of athletics, certainly the elite level, but also the every person. A large portion of us that work in sport have clinical practices that have the high school athlete, the Sunday morning running club, and the older adult athlete, post retirement. And it's through the lens of training across disciplines, as well across lifespan, through physiotherapy, primary care, sport medicine, orthopedics, and other specialties. And it's a 1 year program, and it's designed for working clinicians to um, have a hybrid learning experience of online and in person at a master's level in a 1 year program. So if you go on the website, you'll see that there's an umbrella of advanced healthcare practice programs, of which sport and exercise medicine is one of them. It's the only program that has physicians and physiotherapists training together, and it's the only sport and exercise medicine degree for physios and physicians in Canada currently. The way the courses are set up is there's sort of some shared courses with other fields, as well as field specific courses. Now, some of the course names and may change slightly, but essentially there's shared courses across all disciplines, including some research methods, professional practice, research experience course, and then there's a mentorship piece, and that can be practical as well as professional, and I'll explain more about that later. And then there's three areas that are explored in the other complement of courses, and they are related to upper and lower quadrant, but also transformational topics. And when I say transformational topics, a lot of things in sport medicine change rapidly, and are beyond some of the currently published competencies for things that we map to in sport and exercise medicine. Things like wearable tech, post-COVID, issues with athletes, et cetera. So we try to reflect on what's going on currently and make sure we have the most up-to-date information. This course structure may change slightly, but essentially you'll get a sense that there's three terms. There's online content weekly, but there is on-site residencies, and I'll explain more of what goes on in those residencies in a few slides here. But that's really the times that we get to get together practically, go to our sports science labs, go to the Fowler Kennedy Clinic biomechanics labs. Our diagnostic ultrasound courses, et cetera, are all done during our time on campus. The mission for all of the advanced healthcare practice programs are really to create world leaders in education and in health, and through transformative processes in research and education. This is a master's level learning, and so we try to hit all the pillars in advanced healthcare practice. You'll see that in the physiotherapy and sport world that there's international governing bodies that have very clearly defined competencies. And the Canadian Academy of Sport and Exercise Medicine on the physician side have also very clearly mapped out competencies. And the course is designed for both physios and physicians to train together to cover off all of these competencies. So in our mixed delivery method, every Monday night we have a 2-hour session, and that is a synchronous session, and we'll have physiotherapists, primary care sport medicine, often orthopedic surgery or ENT, dentistry, depending on our area. That week that we have topic, we'll try to bring people that actually work in sport medicine field in those areas to go through real-time cases with us. There is some asynchronous prep to get ready for those Monday night sessions, and you'll see those cross-cutting themes tied together with our on-sites. We picked Monday night because a lot of times in sport medicine, Monday is a day where there's a little more flexibility with teams. They're often not traveling. And the same with our on-site. We don't get together in person till the end of November, beginning of December for our first on-site residency, because often the beginning of the fall in sport is a really quite a busy time. So this is just a screenshot of what your day would look like online. We try to put all your resources really on one page in our platform at Westerns, and there's a bit of a checklist. I don't want busy clinicians coming home and wondering, okay, what am I supposed to do? Where am I supposed to look? All the resources and things that you're supposed to do for that week are there at a glance on the dashboard. And then there's like a little intro, 2 or 3 minute to the topic of the week, and you'll see that there's like a little wrap up at the end of the week. The questions may have cropped up through forums during the week or outstanding questions from our on-site. It's just a nice way to consolidate any information for the class. The strength of the program is really who we bring in. This is a snippet just from one term, and you'll see that you may recognize some faces, people from concussion consensus, or people that are positioned in CASM or other areas of sport and exercise medicine around the world to try to bring really contemporary perspectives and the most up-to-date information in whatever area. And like I say, we would probably have 3 times as many people that are on the screen here. I found sometimes in sport, when I was training, there would be, things that were told to you, and you try to find the primary source, and it was a little bit difficult. Sometimes I'll use dentistry as an example of put a tooth in milk, and I'm not sure if someone wrote that in a napkin in Sarajevo in 1984, but they told 2 friends, and then they told 2 friends, and what we've done is gone back to the dentistry that works in sport and had them provide content from profession's first person perspective, and We try to do that across themes. Some of the on-sites that we do, we spend some time, doing some functional training, spend some time at the Fowler Kennedy Clinic, and in the biomechanics lab. For example, doing isokinetic testing. We know that people aren't coming back to be biomechanists, but we try to be familiarized enough with the equipment and the data that it's easier to read and synthesize information that is very quite valuable, that may be just hard to interpret as clinicians. So all of this is through the lens of very applied clinical work. We spend time, obviously, looking at different sports equipment and fitting and removal of those types of equipment. And we also spend time, multiple sessions in the exercise physiology labs, and getting really familiar with, even though we're not creating exercise physiologists, but people that can work in those worlds, understand those types of terminologies and work with people on those teams in the exercise science realm. We certainly do some of the more traditional stuff, like just taping, bracing, slinging, emergency scenarios. But we also do a lot of clinical reasoning, and you'll see in the center picture, Dr. Joseph there. He works in hand and upper limb clinic. He was the director of primary care sport medicine at Fowler. He also is a merge doc and currently the rowing CMO. And we spend a day together just going through cases with physios and physicians as a sort of an injection workshop, where, what, when things should be injected. Is it diagnostic? Is it treatment based? What are all the inject dates, and what do they sort of look like? So it's kind of neat with the point of care ultrasound and the Doppler, and where and when those things are used. And that's been a popular session. We also do a lot of clinical placements. So at the Fowler Kennedy Clinic, we try to reflect on people's learning contracts of what they want to get out of this degree. And we do clinical placements in orthopedics, primary care. We spend some time with bracing, also with radiology, et cetera. And each week in our on-site, in our online, we have relevant radiology and pharmacology incorporated into every week as well. This just happened to be a case that I saw with some of our students that was a hyperextension injury of a knee, a multi-leg injury. Unfortunately for this individual, they tried to jump a bench with their soccer cleats on, and they slid their body went under the bench, or their leg went under the bench, their body went over top, and this person actually avulsed their common peroneal nerve in the posterolateral corner. So you'll get to see a lot of acute injury, clinical pattern recognition, and trying to look at common things that happen in sport and from an epidemiology standpoint, and have good care pathways and algorithms understood. There's also lots of field opportunity. We encourage people to be doing sport coverage on their own in their own communities, wherever they are. But also there's often events going on in and around Western. There's a lot of high school events. There's varsity events. This summer was the Ontario Summer Games here. The National Cross Country Championships were here a couple of weeks ago. So when possible, we try to get out and get those field experiences in. These are the dates for our on-site residencies for this year's class. So we just finished from November 25th to December 6th. Like I say, those dates will definitely change for next year, but it gives you a sense of, the amount of time that we do have together in person. Again, we've got some pictures here. We do a sport first responder and a stop the bleed tourniquet session as well, which is sort of nice to review some of those skills. Many people on the course have done these types of things many times, but it's always good to be up to date. And we try to do it in a a problem-based manner, um, relative to the way a physio and physician may work together on multidisciplinary teams that maybe incorporate many other healthcare providers. Um, Pictures back, duplicate pictures. I wanted to give you also some pictures of some of our alumni. Some of these folks have done fellowships in London, um, and prior to doing the sport and exercise medicine. Um, but these are some things I put together for the CASM exam. We had our annual general meeting in Niagara at the CASM conference this year. So Brendan Seville is working in the college system. He's our head therapist at Fowler Kennedy, at Fanshawe College. Um, some of you might know Denise. She's worked at Cirque, and she also has an interest in traveling and doing some things with, artistic gymnastics. And one of our physicians left and had a job with Toronto Rock Lacrosse. Sam Myers, currently at Cirque du Soleil, and they're doing a show out of Nashville. Many of you may know Nicole Sullivan. She's been a, a regular on the sport and exercise medicine scene, especially with beach volleyball. I think Nicole had the nicest venue in Paris this year. Scott Sear uh, loves hockey, and he's a therapist with the Calgary Flames, and that's a picture of him at the outdoor game last year. Couple of SEM grads that we were fortunate enough to still have at Fowler Kennedy, Casey Nishimura and Daniel Strykars. They help a lot with our varsity group, but also with our London Lightning basketball team. Lynn Leger covers a lot of hockey over in Quebec. Winter Spitfires, Jason Chung is their physiotherapist. David Albines is doing his PhD down at Brock right at the moment, and providing care down there. Ainsley Oliver, up at USask, is a graduate of the program. And Andrew Try, some of you from Toronto may know Andrew, and obviously he had a great ride with swimming this year. Diana Molden is lots of different places at lots of different times, and is a mentor with this program. And Vic Singera, he told me he was working in wrestling, but I wasn't sure that he was what kind of wrestling. He sent me a picture of him in the Rock, so I don't know what Vic was up to, but it seems like he's always somewhere. Anyway, those are some people that are working in sport. There's my email if anyone has any questions.